Good evening. Welcome to this edition of the 411 Talk Zone radio show. My name is Leon Jones. Tonight's topic: cigarette smoking can cause mental health issues. Cigarette smoking can cause mental health issues. Now, let me give you some information. According to the statistics from the Centers for Disease Control, known as the CDC, nearly 18 out of 100 United States adults age 18 or older smoke cigarettes today. This means that an estimated 42.1 million adults in the United States are already cigarette smokers. Even more stunning, on average, smoking causes around 480,000 deaths per year, which, if you average that out, it's 1,300 deaths per day. It is expected that 8 million people will die in 2030 if the current smoking rate continues. Now, let me give you a little background. Smoking is said to stimulate pleasing and enjoyable emotions. Smokers claim that it helps boost their mood, alleviates minor depression and small fits of anger, improves concentration and short-term memory. It can also provide a modest sense of well-being. This is because cigarettes contain the addictive substance nicotine that stimulates the dopamine in the brain, which is responsible for pleasurable sensations. However, the more you smoke, the more your nerve cells become immune to the pleasure brought on by smoking. As a result, smokers tend to increase their intake of nicotine to get that desirable feeling from smoking. Despite the pleasure that one gets from puffing a cigarette, remember this: smoking comes with devastating health effects. If you think smoking an e-cigarette makes a difference, it doesn't. Researchers actually found that an e-cigarette contains more than 10 times the level of carcinogen contained in a regular cigarette, formaldehyde and acetaldehyde. Both harmful toxins were also found in the vapor produced by several types of e-cigarettes. Remember, while smoking makes you feel good for a period of time, it slowly kills your body, and it is the leading preventable cause in the United States. Let me say that again. Smoking is the leading preventable cause of death in the United States. Now, smoking does have side effects. Now, what are they? Smoking harms your body and may cause permanent damage to your health. If you're still not convinced about the dangers, take a look at some of smokers' side effects. First, they have short-term effects, and everybody knows these. Smokers tend to have smelly clothes and hair, bad breath, yellow or brown teeth stains. Your physical appearance can also suffer, as smoking can lead to premature wrinkles, gum and tooth loss, and sudden weight loss. Stomach ulcers and weakened immune system are also possible smoking side effects you might experience. For young people, there is a high probability that they will continue smoking into adulthood. As a result, it will impair their lung function and growth. Teens who smoke are also 22 times more likely to use cocaine. Now, according to a new Australian study, female smokers may experience worse menstrual cramps than those who don't. It is likely to happen as the amount of oxygen that travels to the uterus decreases when you smoke. Researchers say that women who started to smoke at the tender age of 13 have a 59% risk of having painful menstruation, while those who started to smoke at 14 or 15 have a 50% risk of experiencing the effects. Now, there are long term. That's right. Like the great Isaac Newton said, for every action, there's a reaction. Well, when you have short term effects, there are also long term effects. Many people don't begin to feel the severe side effects of smoking until years later. Once you begin to feel the symptoms, you know the damage has already been done. Some damaging side effects of smoking cigarettes include cardiovascular health problems. Now, smoking poses a great danger to your heart and blood vessels. It damages the structure of your heart and the way your blood vessels work. Smoking increases your risk of having a heart disease by by 2 to 4 times, as it causes the blood vessels in your heart to thicken and grow thinner. It makes your heart beat faster, your blood pressure rise, and causes your blood to clot. When a clot blocks the blood flow, that's right, when the clot blocks the blood flow to your heart, it cannot get enough oxygen, which damages a part of your heart's muscle or even kills it. People who smoke have a higher risk of atherosclerosis. That's right, it's atherosclerosis. That's right, atherosclerosis. Some of those medical names are very hard to pronounce, but I believe the last 2 out of 3 I've gotten. I can pat myself on the back because now I know that's a disease where the plaque liquids build in the arteries. As time progresses, it will cause your arteries to harden and narrow, which will limit the flow of the oxygen-filled blood to other parts of your body. Smoking may also lead to coronary heart disease, known as CHD. Once the plaque, that's right, once the plaque liquid builds up in the coronary arteries, it can lead to chest pain, heart attack, heart failure, and arrhythmias or death. That's arrhythmias or death. Another side effect of smoking cigarettes is what we call the PAD, the peripheral arterial disease. That's right, the peripheral arterial disease, which happens when plaque builds up to the blood vessels that deliver blood to the head, organs, and limbs. Smokers who have diabetes and take birth control pills are at greater risk of having serious ailments to the heart and blood vessels, increased risk of stroke. Smokers have a 2 to 4 times increased risk of having stroke than non-smokers. It happens when a blood clot or a clot blocks the blood from your brain when an artery around or in your brain explodes. Respiratory problems. Our lungs are equipped with a layer of internal mucus that serves as a protective shield for foreign materials that we inhale. By wiping off these contaminants with small hairs called cilia, but with smokers, cilia cannot function properly as these tiny hairs basically work slowly. As a result, you cannot cough, sneeze, or swallow to get these toxins out of your body. Smoking can trigger or make asthma attacks even worse. It may cause chronic obstructive pulmonary disease, known as COPD, which includes emphysema and chronic bronchitis. In emphysema, the air sacs in your lungs will eventually lose their elasticity and start to worsen. Now, chronic bronchitis happens when there is swelling in the linings of your lungs and it constrains your breathing. There are also pregnancy complications. Now, pregnant women who smoke have a higher preterm or early delivery, miscarriage, or stillbirth. They may encounter sudden infant death syndrome, known as SIDS, ectopic pregnancy, or oral facial clefts for the newborns. Women also have a great tendency of having weaker bones after menopause. Reproductive health function. Men who smoke may encounter erectile dysfunction, poor sperm quality, and sperm defects. For women, smoking may cause reduced fertility. Now the big one, as we talk about cancer. Cigarettes contain over 7,000 chemicals, some which can cause cancer. These include formaldehyde, benzene, polonium-210, and vinyl chloride. Even worse, smoking can cause various kinds of cancers anywhere in your body, not just in your lungs, as bladder blood, which we call acute myeloid leukemia, cervix colon, and rectum or colorectal, as kidney, that's right, esophagus, kidney, and uterine, larynx, liver, oropharynx, pancreas, stomach, trachea, bronchitis, and, of course, lung cancer. Now, one thing that people don't understand, what about the fertilizer that we use? Did you know that your body accumulates harmful radioactive chemicals from cigarettes? Well, these dangerous elements come from pesticides used in tobacco fields. That's right. While it is true that smoking cigarettes can cause cancer, there is a more specific substance that is the root cause of cancer among smokers. Tobacco fields typically use calcium phosphate fertilizer, which contain polonium-210. When polonium-210 decays, it releases alpha particles that can damage human cells that they come in contact with. Research suggests that main lung damage comes from the radiation emitted by these fertilizers. It is also showed that polonium specifically causes cancer in laboratory animals. Now, moreover, according to the studies that were made in 2009, the radiation that you get from smoking 1.5 cigarette packs is tantamount to 300 chest x-ray films per year. A 2011 report from Nicotine and Tobacco Research also revealed that there are internal documents stating that the tobacco industry has recognized the danger brought by those radioactive chemicals. According to these papers, acid wash was found to be an effective solution to removing polonium-210 from tobacco leaves, but the industry avoided using it as it would lessen the pleasurable effect of nicotine smokers. The tobacco industry, because they want to make money, will not be your number one motivator in stopping you from smoking, even if they know that this may lead to your death. It is now your decision as an individual to throw away your smoking habit for a good cause, and a good cause is to keep you living longer and choose a healthier lifestyle, which can add more years to your life. Now, what happens when you smoke? The process of quitting requires determination and patience, as it will affect you both physically and mentally, so be prepared for its withdrawal period. But nonetheless, it will greatly benefit in many ways, even just minutes after quitting. Now, I'm going to give you some tips on quitting. People who have been addicted to smoking for a long time still have hope to turn over a new leaf. I suggest everyone who smokes to practice these prevention techniques. Number 1, choose a day. Pick a day that is not stressful for you so that you can prepare yourself. That's right, you must prepare yourself by selecting a day. It could be your birthday, anniversary, or even the first day of the month. Number 2, don't quit alone. Telling somebody about your decision to quit can give you an enormous support system when you feel alone in your battle to quit, because you must be a person who's going to be committed to quit. It's going to be difficult at first. Know your nicotine replacement options. Nicotine replacement therapy, known as NRT. It's number 3. Can be a help in quitting smoking, as it can help you overcome the withdrawal symptoms. It is considered safe for all smokers except for pregnant women and people with heart disease. The Food and Drug Administration has approved 5 forms of nicotine replacement therapy: the patch, gum, nasal spray, inhalers, and lozenges for those who are attempting to quit. But it is still best to ask a medical professional about which form of NRT is most suitable for you. Number 4, get smart about your smoking. Keeping a journal can help you track the situations that helped you up or pushed you down in your attempt to quit smoking, so you can determine how you can deal with the issue without reaching for a cigarette. Number 5 is identify your triggers. Make a list of all things that you've done in the past that involve smoking before you quit. Prepare yourself on how to deal with it. So pick a day again. I call it a preparedness day, a day to prepare. Again, get yourself a journal, just as I mentioned in the first order of business during these tips to help you stop smoking. That's right, because smoking is definitely bad for you, and you're making the tobacco industry very rich. Just remember that. And you're taking years off your life if you continue to smoke. So be fair to yourself, identify those triggers. Number 6, big, change the what, where, when, and how you smoke. Altering your habits. That's right, altering your habits. The time and places where you used to smoke can help you during your attempt to quit. Number 7. Well, we call this number 6. Spring clean. Wash and throw away everything that reminds you of smoking. All right. Spring clean was number 7. Correction. Here's number 8. It is getting support, whether it's from family or friends or your loved ones or your partners, whoever you surround yourself with, who's in your backyard or your corner to support you. It is great that you can get help from communities, particularly of former smokers as well, because they understand what you're going through, because they went through the same issue about smoking and they may have gotten the proper help. So utilize their sources as a support system. Again, get help from communities of former smokers or a clinic that specializes in helping those who want to quit. Number 9, quit day and beyond. This is big. You have to adjust your behavior to identify the triggers that make you want to smoke. In other words, we're talking about the habits. Smoking is a bad habit. And number 10, be like Nike. If you're going to do it, just do it. Don't talk about it, just do it. Commitment is the key to be successful in your attempt to quit. It will certainly be very, very difficult, but it's worth it. Quitting smoking is a commitment. Again, I'm going to repeat this because repetition is the mother of all teachings and skill. It's going to be hard. I'm giving you the real deal on this issue. Stay focused. I advise you, if you're smoking, do it as early as you can, because I really believe that having a healthy, smoke-free lifestyle will not only benefit you, but it'll benefit everybody else around you. So remember, like the United Negro College Fund used to say, it's your future, it's your choice. Cigarettes are a billion-dollar industry, and again, the tobacco industry is not going to tell you to stop smoking. Why? That's money coming out of their pocket. It's just like the pharmaceutical industry. That's a different video. But too many of us are smoking. And not only is smoking bad for you, you have a number of us, or a number of people who are dipping tobacco. That's got nicotine in it as well. Again, use the alternative measures out there if you feel you have to have a cigarette, because you're going to go into withdrawals or remission. But the bottom line, you as an individual must stay focused. And once you are able to quit, then you go out there and teach somebody else about smoking as well. Because let me tell you something, smoking can take 15 years off of your life. And if you want to go out on a date or something, do you think somebody who is a non-smoker wants to take their attempt to kiss you, smell your hair, your clothes? Absolutely not. It is a disgusting smell. And then one thing about smoking, even smokes up your house. That's right. Individuals don't understand that. And sometimes people who smoke have done it so much, they don't even realize the odors that smoking carries. But they carry some bad odors, particularly if you don't smoke. And also, for people who don't smoke, secondhand smoke can kill as well, because they're inhaling the toxins or the nicotine that you are exhaling. You must remember that. So again, what I'm trying to do in this video is to keep everybody who smokes and non-smokers aware of what smoking can do for you. And again, I've been doing a number of videos on mental health issues, and you see some of the same issues like stroke and high blood pressure and cardiovascular. They appear right here in the smoking section as well. So again, if you're smoking, this is your time to quit. Because if you want to add years to your life and help save a life, and I'm talking about your own life and others, you will be wise to drop cigarettes at this time. And it'll save you money as well, because you have to go out and find time to buy cigarettes, and you want to give the government more of your money to kill yourself, because that's what you're doing when you're smoking cigarettes. Just remember that. The decisions you make in life can come back to haunt you. So I want everybody who's a cigarette smoker and somebody who's not, be wise. Smoking kills. It's another silent mental health issue, and it can kill you in more ways than just cancer. You've just heard the information that I presented in this video. So, I want everybody to sit back, get this information, and put this video out to everybody who's a smoker. Stop smoking at this time. Save a life. And that's your life and others. Be smart. Don't work hard. Get educated on cigarette smoking. And that's my commentary for this edition of the 411 Talk Zone radio show for this evening, Monday, April 24th, 2017. Tune into the 411 Talk Zone radio show every Saturday from 6 p.m. to 8 p.m. on Blog Talk Radio. Guest call-in number is 215-383-5785. If you like my videos, please share and subscribe to the 411 Talk Zone radio show right here on YouTube, so I can continue to give you quality information for educational purposes from a professional and mature perspective. Now, on this channel, I don't engage in controversy, nor do I engage in debates or emotional issues. Also, I don't participate in drama or unnecessary bickering. It's counterproductive. This channel is for educational purposes only. I'm here to provide you the insight. I'm a pragmatic person, so I'm giving you the tool so you can learn how to deal with the real world, because just like cigarette smoking, you must be smart if you want to survive. And without this knowledge, it's going to take years off your life. So I want you all to know that I'm giving you the real information from a positive perspective, because knowledge is power. And if you have a business, a topic, or YouTube channel that you would like for me to discuss on YouTube or Blog Talk Radio, please email me at lej6521@gmail.com. And if you have a comment, please leave your comment in the comment section under the video. But make sure that your comments are pithy. No bloviating, pettifogging, or filibustering if you wish to opine. That's it for this video. Till next time, my name is Leon Jones. Remember, please be gentle and respectful to each other, and have a wonderful and blessed night. Good night.